Doctor, thank you so much for highlighting the importance of NO, where you mentioned even within seconds, we do not have, NO, it's like we will die kind of thing. NO is like no laughing matter, huh? And I like what you say about, FOC from our creator, and when we are good, when we are calm, we are forgiving, when are happy, our NO will increase. That's very interesting.
We are forgiving as well. Forgiving.
Yeah, forgiving. Correct. That's so interesting. Forgiving. That's a good point.
That is proven. Clinical hypnosis, we know that. You're forgiving, then you have freed yourself for NO production. That's why people who forgive and forget. Then they wake up and they can smile. The others will suffer heart attack.
So important, huh? But I like also what you talk about, the importance of nitrates and nitrites pathway, huh? I think that's really very powerful when you talk about it and how it's relevant to us. Let's look at the questions. The first question, Jermaine, could you can nitric oxide for people who is tested for urine culture and have a trace of occult blood, this person have a history of kidney infection since at a young age, but it's okay until just recently, after 50 years of testing this urine culture, this problem arise again. Can you see the questions?
Yes, I can.
Okay, then go ahead. Yeah, please proceed.
I see no harm in taking. That there may be a reason for this occult blood. It has to be investigated. But even if it is a tumor, for example, occult blood, usually we are worried of tumor. We are worried of chronic infection. Nitric oxide does have a role. Nitric oxide is anti-infective. If there is infection, it helps to clear off. And at the same time, if there is a tumor, it is anti-tumor as well. It's our body's part of our body's natural immune system. So can be used, can be taken apart from the conventional treatment. Yeah.
Okay. Thanks. The second question. Yeah.
Can be used for people chronic kidney disease. Yes. Kidney disease is basically caused by disease of the glomerulus or the filter of the kidney. And glomerulus is a collection of blood vessels. Blood vessels in the back, that is the glomerulus. And this blood vessel, it has got endothelial cells and everything. And that we know that for a fact that nitric oxide, we have got a lot of scientific references. Nitric oxide does improve the health of the endothelial cells. It does make the blood vessels healthier and functioning. And for that reason, at every stage of kidney disease, nitric oxide helps. It helps to get more nitric oxide, apart from the treatment that has been given. For asthmatic patient, number 3, what dosage to consume? I would say you try the usual dose, which is if adult, we give 1 ml twice a day, right? So twice a day. And if the response is good, some people respond very well with the previous one that I used. And some people will need higher dose. So maybe the certain time of the year, they have more for many reasons, weather and all that, they have got more asthmatic attack, then increase it to 3 times a day, 1 ml 3 times a day. Can kids take NO? Yes, kids also do. Interestingly, I asked that question to Dr. Prendergast. He said in America, the newborn also, I gave a bottle of nitric supplement, and they're very well. He's an endocrinologist and he studied the issue. Maybe slightly later, because our body can adjust a naturally occurring molecule. Our body knows how to handle, because we use nitric oxide in the body. If it's excess, it knows what to do. You give medicine, it's different matter. Medicine manufactured in the lab by Pfizer, it doesn't know. The body doesn't know. There was no Pfizer when we were designed, so it doesn't know. But if you give it to our body, something natural like nitric oxide, it knows what to do with the excess nitric oxide and stuff. Of course, you can give half of the adult dose for kids, for example. They may not need so much. They don't have hypertension, diabetes, and other issues. What is half-life of nitric oxide? That depends very much on the pathway. This is very the half-life of nitric oxide as a gas is very fast. It's less than 1 second. But you perpetuate it through the cycle. When you give L-arginine, you use L-citrulline to lengthen it. The one that I showed pro-arginine, for example. The half-life is around 3 hours, I would say. But with L-citrulline added, it goes longer, 6 or 7 hours or 8 hours. We know how do we know its efficacy? We saw it. It reversed gangrene. It reversed atherosclerosis. We have seen the result. And of course, it improved patient with kidney failure. And the high desert heart study, for example, a lot of the people who have been on maximum medication for heart problem, and they still have the problem. When they are given the nitric oxide supplement in the high desert heart study, the detailed results are there available. They really improve. You just type Angelo Cicci testimony, A-N-G-E-L-O, Angelo, is of Italian descent, CICI, Angelo Cicci. He had pulmonary hypertension, it improved. And pulmonary hypertension, for example, one of the treatments is Viagra, because nitric oxide is used for treatment. So it does improve. It does improve. To be more exact, Dr. Siva Salam can answer. He has got the detail. He does the measurement. But having said that, we have more than just one testimony where so many people who I've seen in my practice, people who improve with nitric oxide supplement, including learning ability increases. Number 6, how do you counter some side effects reported from internet? Noisy breathing, blood urine, low blood pressure, collapsed lung. No, I don't see that. The only problem is migraine. Some people have got migraine, and when they take extra nitrate, they have headache. That is very common. And these people, you just give a low dose first until they tolerate that dose, then gradually increase. Then you see no problem. They know, and they have migraine with a lot of things. People who have migraine, they have a lot migraine with a lot of things, not just medication, a lot of things, weather and all that. But you use a small amount first, and you increase gradually. Usually they can tolerate. It may damage brain cell literally. No, that's nothing. It can be used to treat Parkinson and some Alzheimer's improve. Huntington disease, amyotrophic. It doesn't damage brain cell. There is no evidence whatsoever. No reason to think, because it is a natural substance which our body used to repair. It's a repair molecule. I think that one comes from just like all the other, a lot of things in the internet. A lot of things. There are a lot of things which are not based on anything. It's just somebody type. That's all. Low blood pressure usually is not a problem with the supplement. It's more with medication, because as I said, a natural molecule our body knows how to handle. So if the blood pressure is very low, no. That particular physician, consultant physician who introduced me to nitric oxide supplement, his blood pressure was 110/70 or 110/60, like my blood pressure now. But he said when he took the supplement, he had less giddiness. It won't go further. Medication will do that, but not supplement. It works differently. Our body handles supplement differently. It is something natural to it. It knows how to handle. Number 7, I have an elderly doctor friend who is suffering from Parkinson. Yes, from Parkinson, you can try. May I also recommend you introduce this one first? And the other thing is, of course, coconut oil will help. This is the science is very clear. You can try Parkinson, but there are other things as well. Other nutraceutical apart from nitric oxide. Is NO supplement safe for all conditions? I would say so. Yes, supplement is safe. Any contraindication? Can anyone take arginine? Yes. I don't see any contraindication if it is just supplement. If it is in the form of medication, because the pathway is different, the way it is presented is different, like Viagra, then there are some contraindication. But supplement is different. And supplement is actually food, which has an effect, nutraceutical. I see so. Last time we used to say the contraindication is viral infection, herpes zoster. But now it is established to be antiviral. So we used to say, is there any contradiction? Yes. If you have viral infection, don't take. You have very bad runny nose, don't take. Wait until you recover. Now they say you have COVID, you take. So it's that's how. But naturally so, logically, this is what our body uses for its immune system and all that. So there's very little contraindication. Can anyone take arginine? Yes. And in fact, it's given for burns last time. Number 8, 9, do we experience what kind of dosage? What kind of dosage recommend dialysis patient? I would say NitroFX, you start with low dose, 1 ml, and for 1 ml for 3 or 4 days. If the patient feels quite good, feels some better sleep and all that, then you increase to 1 ml twice a day. Then then within a few days you go to maximum 1 ml 3 times a day. Within a week, you go to 1 ml 3 times a day. For patient with the pro-arginine, which I used a lot for this last time, we started very low because of fluid restriction. When they started passing urine, then we gradually increase. And then they can reduce their hemodialysis frequency, for example. So I would say with NitroFX, I would say 1 ml, maybe a week, and see whether they improve. Then increase to 1 ml twice a day. And if they feel better and they feel like passing urine or they start passing urine, then you quickly increase to 1 ml 3 times a day. And for example, for gangrene, I will use the maximum 1 ml 3 times a day or 4 times a day even. There is very little danger of that. The gangrene will kill them. But I have seen, I would say, gangrene, they respond within 24 hours. So much so, I have felt very irritated because they come in a wheelchair and other patients could understand why they went in first. Tomorrow morning, they come walking with sunglasses and they walk in straight and people are very, very unhappy.
Okay, any other question? Dr. Azaman, are we still connecting with you? I'm not sure whether the line is hang. Can you hear us, Dr. Azaman? Just hold on, ladies and gentlemen. I'm trying to connect to Dr. Azaman. Let's see whether what happened just now. Hold on.
Yes. Can you hear me now? Sitan, can you hear me? Okay.
Yeah. Okay, now it's good. Yeah. All right. Sorry, we take this few more questions. Jermaine, any more questions? A few more before we end?
Yeah, we are here. I'm 62 years old. My heartbeat.
Yeah, Dr. Azaman, number 10, please.
Yes, number 10. My heart, after taking TOH, what is TOH? After taking TOH.
TOH is a triangle of health.
Oh, okay.
Yeah.
Yes, then it's working. It's working. then it's working. 120 is you have tachycardia. There are other reasons, but now heart is normalizing. 90. That means it's responding. I would say that is a good response, positive response from the triangle of health, which includes nitric oxide. What are the vegetables or fruits that have high level of nitric oxide? I know noni very well. There is also beetroot, we know. I think bayam has got, spinach has got that. What else? Offhand, those are the few that I know. But there are number.
How about kale?
Kale as well. But nothing compared to noni, if you ask me.
Okay.
I'm a bit prejudiced in that because my grandmother, for example. But I have done some research even before this, and that is also what Kuli Tengku Razali Hamzah said. He has tried other things, but it's noni that works very well. Can a senior citizen, age 93, have high platelets count of 2,000, 4 times the normal, take nitric oxide? Yes, no problem. And in fact, one of the functions of nitric oxide is that that 2,000 means it's not high. Platelet is 150 to 400,000, for example. 4 times, sorry, this is different unit. 4 times more than normal. You can. It has got an anti-platelet nitric oxide naturally is anti-platelet in the sense that it prevents excessive bleeding. It prevents pathological bleeding. It can be taken. Importantly, I know can take warfarin, it's okay. Okay. Warfarin is a bit of a problem. Warfarin. I would say that if you want to take, if you are taking warfarin, I wouldn't recommend nitro extreme because there are more things there. Just nitric oxide will be all right, but you have to maintain the dose. You maintain the same dose. Say you take 1 ml twice a day, then you maintain that and you go and check your warfarin, check warfarin, check the blood. What do they call it? You check the bleed. There is a test that they do to see whether that warfarin is national. I've forgotten the name in the parliament for 8 years. But you go and check. But if you maintain the same dose, I think it should be all right. But not extreme, because there are many other components there that may affect warfarin. Nitric oxide alone will be all right. But you have to be consistent. You keep on taking the same amount. You say you take 1 ml twice a day, then continue taking that. And of course, monitor if there are bleeding tendencies. If there's none, then you go and check regularly for a while. Then if it is acceptable, you're within acceptable limit, INR. If INR is within acceptable limit, then continue that particular dose. But not too many supplements, because if you want to use supplement, take 1 at a time for when you're on warfarin. But nitro extreme has got a few other things in. It's very difficult to measure. It is best that you take nitro FX only. Does nitric oxide help with vertigo? There are people I heard they have improved because after all, vertigo also there are many causes of vertigo. But one of them has got to do with blood flow to the brain also. When you normalize that and you maintain a steady blood flow to the structures in the brain, it does help a bit. Can try, no problem. Can try. And it's just people who have told me that their symptom of vertigo improved after they took nitric oxide. Can cancer patients still under chemotherapy? Yes. Cancer patients, yes, they will benefit from taking the TOH, the triangle of health, which are supplements. They do help. They do respond. All these things, and in fact, when you're on chemotherapy, the body is under great stress. It needs more vitamin C. It needs more B complex. It needs more antioxidant to help it. that should be very helpful. Any benefit for autism kids? I do not know. Number 16, I don't know because I've never tried it. Autism kids, I don't know. But if there is some study or some people with experience, I will communicate to Mr. Nicholas Tan, and inshallah we'll know. 17, may I know when to take warfarin? It's okay or anything? Again, the same answer. 17. I would suggest if you are on warfarin, start by taking Nitro FX only first, and you can take any time, but take preferably you take at the same time of the day, same time in relation to warfarin. If you take warfarin first, you don't have to wait. I think I should wait half an hour is okay, or you take half an hour before, half an hour after, also is okay, but make it same time every day, and same the dose of the warfarin and Nitro FX, make the relationship same, constant. You can take before or after, but make sure that it is every day before or after, and then you go and check your INR. But if the INR is acceptable, then continue. Nitro Extreme, you can try later. After you are stabilized, then you can try Nitro Extreme later. Then if you find it well, it doesn't disturb your INR, meaning your bleeding tendencies are normal and acceptable, then you can continue. Then fresh noni fruit, yes, you can take fresh. That was what my grandmother used to do every day, almost every day. Whenever she had access to noni fruit, the fully ripened one is very nice to take. In fact, I like that, except for the smell. But the very ripe fruits usually are not that smelly, and they are very nice to take, very tasty, in my opinion. Why some people after taking Nitro FX they feel tired? That the initial reaction when you just take Nitro FX or nitric oxide, just like some other supplements, strong supplements, your body will move into a new set of metabolism. It's a different metabolism altogether, and your body is adapting to that particular new parameters. That is called the healing crisis. You can feel tired for a while, but that should not last very long, and after that you can start having the benefits. Some people will have pain also because they have old injuries, for example, and now blood is flowing there and they have quite a lot of pain. Feel tired also can happen initially. This is seen in some supplements as well as some medication, but it's not to be worried about.
Okay. Wow. Thank you so much, Dr. Azaman. You have covered so many questions. I think important for us to understand that taking nitric FX and all that is a supplement. It's not it's a treatment field. I think we have to be very clear about that. But the way you share, and I think your own experience, I think when you take the pathway nitrate to nitrite, that's amazing. Really so encouraged to see how that has helped you and so many people. Thanks so much, Dr. Azaman. I know this is Puasa month.
Sorry for the interruption.
And really appreciate, and so many of us locked in today, and we really appreciate that. Is there any you want to wrap up any comments or anything?
No problem.
Yeah?
Huntington, no problem. No problem. Chronic diseases.
Okay. Anything you want to say before we wrap up?
Can I say a few things? Thank you very much for that opportunity. Number one, I think nitric oxide is a very special molecule. It's not ordinary supplement. This is a basis of life. Life exists because of nitric oxide. That's number one. We are created with it, and as I said, it's given free of charge by our Creator, God, and we should be thankful for it. And you see that when we live in harmony with nature, harmony with others, and harmony with nature means we are dependent on the goodwill of the good bacteria in our mouth to produce nitric oxide. So that should be the way we live for the rest of our life. Should be in harmony. And for that, I would like to remind everyone that we have to take care of our body. But part of taking care of our body is we take care of the good bacteria in our mouth. So be careful about using very strong mouthwash, like Listerine, for example. I have to apologize to this group to mentioning a brand. A very strong mouthwash, don't use. You get rid of now we know that you cannot get rid of the good bacteria in your body. And in the mouth is very important, very critical, because you need them for production of nitric oxide. And because of that, I would say that that is another example of how we have to live in harmony. We are created with good bacteria in our body. We don't wipe them out. So antibiotics, so don't use unnecessarily. Don't use unscrupulously. Just don't keep on thinking antibiotic is a solution. It's not a solution. Solution is to live in harmony with what we have and to use natural substances, get rid of the invaders or those pathogenic and those disease-causing bacteria, but not everyone. Don't use carpet bombing on our own body. So harmony with nature, harmony with the people around us, with the world, and harmony with our body. And eventually, and the other thing is, as Ms. Nicholas Tan said, if we live, we also have got to have a clean heart. We have to feel good about ourselves, and we have to have good feelings about people around us. We should control our temper. We should meditate. We should do prayers. When we are calmed down like that, our body produces a lot of nitric oxide, and it will be beneficial. But if we engage in a lot of things, jealousy, rage, and also we are nursing hatred and anger all the time, it's proven our nitric oxide production as well as level will go down, and that is very damaging to our health. So nitric oxide, at least when we realize the science and we take the supplement, we boost it by being a good person, good individual with nature, with people around us, with God, with environment. Then I think that there's nothing better than realizing that. And I thank God every day for what I've experienced so far, and for giving me the opportunity, and also apart from that, getting me is not a coincidence. When I grow older and the first pathway is not functioning as well anymore, then I get to know what my grandmother has proposed last time, which is
wow.
Wow.
Thank you so much, Doctor. You are not.
I have to apologize for this poor connection and poor picture.
Yeah, but despite that, so thankful because you are also philosophical, and the importance of talking about harmony, with nature and with one another. I think that's so important. Thank you so much, and thank you everybody for listening in. And thank you once again, Dr. Azaman. Really appreciate your time, despite being Puasa month. You've taken this wonderful time to share with everybody. And last but not least, I just want to share one small announcement for everybody. Since we talk about nitric oxide, you know, today, tomorrow, and Tuesday, if you go out and share with somebody, and the person sign up with a builder pack and above, you as the enroller will get 1 bottle of Nitro FX. Yeah, isn't that wonderful? Wow. Wow. Let me share with you the screen, and we will actually blast it out later today. So this is what you get. Just share. And thanks to Dr. Azaman, he's talked so much about nitro and how the nitrates and nitrites pathway will help you. So go and help somebody. And I think we have this wonderful mission in life. I think this is so important, in line with what Dr. Azaman talked about, to bring hope, the promise of a better life through wellness and opportunity. So let's go out, everybody. Thanks again for listening. Thanks again, Dr. Azaman. Really appreciate what you have shared today. Thank you, everybody. Thank you. Thank you so much.